So this is an example where during the consultation we've identified a couple of features, not just nasal features, but other facial features that might benefit from modification as part of the surgery. So this patient came to see me to make changes to her nose, and the main issue I think really was that her bridge was a little bit too high. So what I did was I simulated hump reduction, which we would do fairly conservatively in her because I think her nose actually looks quite good beforehand. But just wanting to take her bridge down enough that it's no longer a feature that catches the eye. So here's a fairly conservative hump reduction. I think perhaps it could come down a little bit more. And that's again something that is up to the patient to decide how much of the bridge they want to have reduced. I can certainly reduce it more if they wish. So that's an improvement in her nose. Here you can see before and after. But I think also what was very helpful in this consultation is when I showed her these side photos, I made a small suggestion that perhaps if we brought her chin forward a little bit, that would also balance out her profile slightly. So again, rather than just saying to her, hey, you know, I think we should bring your chin forward, I said, well, what do you think it looks like if we bring your chin forward? And I can just show her rather than just telling her. So I thought it'd be nice if we could just get her chin to come forward a little bit so that it sort of caught up with the position of her forehead. So this is probably a modest or moderate augmentation of her chin as well. So this is her before rhinoplasty and chin augmentation, and this is what we would expect after. And I think it makes a really big difference when you do both of them. So this is again is an example of identifying a feature that perhaps the patient wasn't aware of, showing them how making a change to that feature has an effect on their overall profile in addition to making a change to the nose.